Hello, everyone. My name is Dr. Vivek Babaria. I am an interventional physiatrist and I am self-employed. I started my own practice in Newport Beach, California after I finished my fellowship and have been in private practice my entire professional career. I'm very fortunate to be joined by one of our astute and esteemed colleagues. Dr. Khwarg, please take this opportunity to introduce yourself and where you're practicing.
Yeah, hello, my name is Dr. Juewon Khwarg. I am currently practicing from Los Angeles, California. I am wearing a lot of different hats right now, but it keeps me challenged and excited. And so it's been an exciting opportunity. And it's been a real honor and pleasure being part of the Future Leaders program with AAPM&R.
Speaking of which, what does the Future Leaders Program entail? How are you involved with it?
Absolutely. So the Future Leaders program currently entails giving us a lot of exposure to the inner workings of AAPM&R. We recently were able to attend one of the board meetings in Rosemont, Illinois, with the AAPM&R leadership, and seeing how decisions are made was very, very helpful. We also do have meetings virtually to discuss various topics on leadership and how we can be better advocates for AAPM&R. And lastly, in April, we are going to be going to Washington, D.C. to advocate for AAPM&R with various government officials to hopefully get PM&R more on their radar of something that's important for patients and brings value in their healthcare.
What do you think are some of the biggest issues that are affecting our field right now?
I think that the biggest issues affecting our field specifically is also in common with all of healthcare in general. Essentially, we're running out of money. Medicare keeps saying it's going to run out of money. Last I heard, it's in 2036 now. Before that, it was 2028. And so there has been this push towards value-based care. And what that means is each medical specialty now has to demonstrate that what they do brings value. It's not so much about pay per procedure as it used to be. It's not about just doing things. It's more about proving that what you did mattered for the patient. And we are still a relatively young field, and proving that what we did mattered is a bit of a challenge still. And I think there's a need for more data, more evidence, more use of sophisticated tools to prove that what we do is helpful to the patient. And I absolutely believe it is, but we have to prove it. And if I look at healthcare right now, I think inpatient rehab facility placements or prior auth denials, the rates are around 40 something percent right now. I think that another challenge is private insurances and Medicare Advantage plans are increasingly denying PM&R care. And again, I think that the reason is we don't have enough data to back up what we did. If we did prove that we were reducing rehospitalization rates, if we were proving that we are reducing levels of disability more effectively, then I think that these payers would be very interested in supporting PM&R, but we got to be able to demonstrate it.
Some of the high level things you're talking about in terms of payers is not something probably we're exposed to when we're in training. For early career postgraduate physiatrists who might not do a fellowship, what kind of things can you give in terms of advice about career placement and understanding the real world that would help them when they get out?
Absolutely. First of all, this is a good time to plug AAPM&R. The organization really does try very hard to advocate for our entire field. And I think that, having that membership, being up to date with all the webinars are extremely helpful. Coming out to the conferences and talking to people with more experience or more engagement with these higher level concepts, it's important because I think the old days when doctors thought all I have to do was do my clinical work and then everything will be all right. It's not that way anymore, and it's further not going to be that way even more so in the future. So it's important to basically know what kind of waters we're swimming in and understanding how to navigate it better, so that you can kind of keep advocating for your patients, keep getting them the care that they need. I recommend reading resources. One big one is KFF. It used to be the Kaiser Health Foundation News, but now it's more of an organized, peer-reviewed news source. Know what kind of regulations and policies are happening right now. For example, Medicare just recently, or HHS just recently released that Medicare funding is going to stay static next year. And one of their big pushes is that we have to do more AI instead in our patient care. So what does that mean? I think that the writing's on the wall. If you want to uh, keep being compensated at current levels and keep being able to be reimbursed appropriately for your patient care, you have to start looking at more technologies. This is something that you're not going to be aware of unless you are paying attention to these things. And I think AAPM&R is a good resource for doing that.
More importantly, you're taking out time to represent all of us so that our lives can be essentially easier to practice. Given that you live in Southern California, work in LA, how and why? Like, what motivated you to take yourself out of the clinical experience to advocate for us and give your free time to doing this?
Yeah, well, I actually did a fellowship in interventional spine and regenerative medicine in Detroit. And while I was doing that, encountering a lot of the physicians, I recognized how challenging it is to be a private practitioner these days. And increasingly, getting procedures that we know are important for these patients is difficult. Getting denied for things that we think patients need has become more common. And I just realized I had to understand what's going on here. I really did not want to be just a part of a system. I wanted to be somewhat of a person who determined how I get to practice healthcare. But I increasingly felt that that agency was being taken away from me. So during the fellowship, I decided to take on more training since being a traditional academic, I apparently love school. I went and got a physician MBA at the Kelley School of Business in Indiana. They have a fantastic physician-only MBA program, very specifically focused on healthcare management. And there I basically had my eyes open to where healthcare is going, what we need to do in order to advocate for the care that we are giving patients, that it is necessary, that we deserve to be compensated for it. And increasingly, that has just taken me down many different roads. I saw the potential for AI early. Now I'm Chief Medical Officer for Curia AI, which is very specifically looking at how AI can be used to help with reducing administrative burden, reducing burnout, and also increasing, or not increasing, but really optimizing appropriate reimbursement for the complexity of care that we're providing. Um, and that, and this is something I feel strongly about because we train too hard. What the services we provide are too valuable to have this agency diminished, and yet that's happening right now in U.S. healthcare. And so I believe that this is something that's important for all of us to at least pay attention to.
While paying attention to all those important things you mentioned, being where you are in your career now, how have you been able to combat burnout and the idea of thinking about money and how the money is going to come into the practice and keep your head afloat? Because I know that was a big part of the last 2 years of the conference is making sure that we can fill our buckets to be the best physicians for our patients.
100%. I believe the study from Dr. Sliwa that was then had a follow-up within PM&R, the Purple Journal, basically said that one thing that really helps is purpose. And for me, as I increasingly take on more hats, I've gotten to look at what my purpose is in this whole grand picture and also approach it from various angles. And I think that one thing that really helped me in my personal career was diversification. That is almost paradoxical in a way because in some ways my schedule is even more booked. Yet in another way, it's more fun for me because I don't feel like I'm just stuck in a routine following a certain flow chart of what I'm supposed to be doing. It's a constant challenge every day. And for someone like me, I like that intellectual challenge. It does keep me going. but also, you know, taking the time off to make sure that I'm doing the self-care. I try to exercise multiple times a week. I do a daily meditation and prayer. I make sure that I make time for my loved ones. And I would say that that's also important. But really, at the end of the day, I do think that having that clear North Star of what I want to do with my career doesn't make the work so challenging to do. And it took me a while to get there, but I think that I'm much closer to where I should be than I was even a couple of years ago.
That's amazing insight. I'm a small business owner with about 25 employees. Given the leadership skills that you've developed and the formal training that you've had, what are some three ingredients to a leader's success that you could share with me and other physiatrists?
Three. Okay, let's come up with those. I think first is going along with that idea of purpose is vision. I think that creating a vision for what your organization and your team is going towards and communicating that clearly is extremely important. You don't want this to be just a job because that's when people check out. That's when people stop innovating, and you are just basically a robot. You're doing a routine, and that can be very difficult. You want there to be a clear vision of what you're doing is important and why you're doing it. Secondly, what I think is very important is the communication part, which was part of that vision, but you do have to be able to regularly communicate with the various team members and also regulate the communication in between the team to say what is going to be appropriate, what isn't, what's respectful, what isn't, and also make sure that your messaging is very clear to everyone that's involved, whether it's within the team and also whoever the team is involved with. Um, Lastly, what I would say is, I said vision, I said communication. Um, hmm, my brain just kind of blanked there. I think vision and communication are very important there. Um, and I'll try to think of a third one, but
Yeah, I'll sum that up into purpose. I think the biggest takeaway, I really appreciate all the leadership you've already given to the society and where you're going to keep going with your class is that when you have purpose for work, purpose outside of work, but then also purpose to drive meaning, you also are helping every physiatrist have more meaning. And we're really grateful for leaders like yourself and the rest of the class who are committed to making sure that our professional presence has relevance and work more meaningful. To sum up and also ask one final question, um, when it comes to future leaders and contributing to this society as well as part of this leadership track, what are things that calling out or why should other members think about even applying for this leadership program?
absolutely. First of all, we they should consider it because we need them. I certainly feel like there is definitely a lot of room for us to continue to grow. And I think that there's a lot of room for new ideas and new innovation. And so I would say, please, if you have even a vague interest in this, consider it. It's a wonderful opportunity. You make a lot of connections, you meet a lot of awesome people. It's very inspiring. The reason why you should do it is because ultimately, these larger picture things matter regardless of whether you choose to engage in them or not. And it's a matter of are you just simply surviving or do you want to play a role in how what way the boat is actually going to be going? And I think that that's a very important question everyone needs to ask themselves because yeah, there's a lot of change right now in healthcare, and it's going to continue to happen and become more dramatic over time. And ultimately, we need doctors to sit at the table and advocate for what we do and for what our patients need. Because otherwise, there's going to be a lot of people willing to sit at that table who do not have the experience or knowledge or motives that we have. And so I think that everyone should really consider it.
Very well said. And as Hamilton put it, you just want to be in the room where it happens. So we appreciate you taking out again from your busy life, your busy practice, supporting all the physiatrists and vouching for us, our validity, and strengthening our field overall. Thank you, doctor, so much for taking out the time to do this podcast with us.
My pleasure, my honor. Thank you so much. Take care.